Hello friends, welcome to Dream PG YouTube channel. This channel will discuss about high yielding and most repeatedly asked questions for those who are preparing for medical PG entrance. If you didn't subscribe our channel so far, please do it and click the bell icon next to it to receive notifications. Feel free to click the like button and share your comments. Hello friends, welcome to Dream PG YouTube channel. Today we will discuss about pellagra. Pellagra is due to niacin deficiency. Niacin is vitamin B3. What are the characteristic features of pellagra? It includes 4D: diarrhea, dermatitis, dementia and death. Pellagra is characterized by skin rashes around the neck. It's called as Casel's necklace. In human body, tryptophan is converted to niacin. The enzyme which helps in this conversion is QPRTase. QPRTase is the rate limiting enzyme for the conversion of tryptophan to niacin. In pellagra, the patient should not take maize and sorghum. Why? Because in maize, the tryptophan is limited. Another cereal, sorghum, is also not allowed in pellagra. Why? Because sorghum has excess leucine. Leucine inhibits the rate limiting enzyme that helps in the conversion of tryptophan to niacin. The other name for sorghum is jowar. Another important enzyme that helps in the conversion of tryptophan to niacin is kynureninase. It is a pyridoxal phosphate dependent enzyme. When vitamin B6 is deficient, that is pyridoxine is deficient, it leads to decreased activity of kynureninase, which in turn leads to pellagra. So the main cause of pellagra is niacin deficiency, that is vitamin B3 deficiency. It can also caused by deficiency of another vitamin called vitamin B6, that is pyridoxine deficiency. Let's have a look into other causes for pellagra. It includes isoniazid intake, carcinoid syndrome, heart valve disease. What are the methods to prevent pellagra? Mainly you have to eat a diet that contains milk and meat. Avoid maize and sorghum as we discussed earlier. We have to keep a niacin recommended daily allowance of about 6.6 mg per 1000 kilocalorie. Niacin is also an anti-dyslipidemic drug which increases the HDL, decreases LDL and VLDL, and it also inhibits lipolysis in adipose tissue. Thank you very much. Let's answer this question. Sorghum causes pellagra due to presence of option A, lysine, option B, leucine, option C, tryptophan, option D, alanine. Yeah, that's it guys.